OK, are people with long COVID being left behind? Well, it can be a debilitating illness, and one charity claims thousands of Scots are missing out on crucial support.
Chest, Heart and Stroke Scotland wants the Scottish Government to set up specialist services for the condition, something that is being done elsewhere in the UK, but not yet here. Stephen Godden reports.
For more than 8 months, life hasn't extended far beyond this balcony for Myra Johnson, still suffering with symptoms after catching COVID at Christmas.
Breathless, you lose words, on bad days you basically don't speak because you don't know what your mouth's going to say.
Fellow sufferers have been a source of support.
Let me know how your week is going so far.
This online group is run by Chest, Heart and Stroke Scotland, who were part funded earlier this year to set up a long COVID service.
I feel varies day to day, and it even varies during the day as well.
Figures published today estimate there are 74,000 Scots with similar stories. But despite that, the charity's support line is still only taking 60 calls a month.
We want to stop people ping-ponging between different parts of the support that they need for their condition. And that's not happening. So it means the data sharing is not in place, and the bureaucracy that's preventing us and the NHS from working together is having a massive impact on people who are living with long COVID. And that's not acceptable.
The charity's action plan calls for health professionals to be given more long COVID training and for ministers to encourage health boards to share patient data to boost referrals, while investing more money in long COVID services.
We've got our bit in place, but we do need the Scottish Government to lead, to direct and to fund to make sure that people with long COVID get that support that they need.
The different approaches being taken by governments around the UK has generated some political heat, mainly around the funding of long COVID clinics in England. In Scotland, the emphasis has been on research.
That's great, says this researcher, whose work evaluating existing long COVID treatment around the country is receiving a share of a £2.5 million Scottish Government investment. Robust research, however, doesn't happen overnight, and in the meantime,
I think we can do better. If we invested in current services and publicised the pathways to access those services, then people would be able to get interventions which we know are already likely to work much faster and much easier.
And continue to do the research at the same time.
Absolutely, that's essential.
And during that process, what's vital is that those with first-hand experience are included, according to Lesley Macniven, who helped set up an online support group more than a year ago.
We're doing as much as we can for ourselves, and we're doing a lot, and we are getting better. But the obstacles we're facing are significant. And it does just require a little bit of a rethink as to how we see disability and how we see illness and chronic illness.
Vaccination cuts the risk that on today's case numbers alone, busloads of Scots will develop persistent symptoms. Long COVID is here for the long haul. Stephen Godden, BBC News.